We are in a state of emergency. We do have a pandemic, as we're all aware of it, and the city will continue to bring you the services. What we request from the residents is, as we go through this very trying time, that we all kind of work together. The Department of Public Works will be active, the police department will be active, and the fire department. Be respectful to them, be respectful to the truck drivers that are out there. This is a time that we come together. Be sympathetic and be compassionate to your neighbors. This is a time like we have never seen before in our lifetime, and it is an opportunity for us as a city to come together.
We try to make sure that our personnel all have gloves on, they all have proper respiratory protection on, and eye protection. If somebody's complaining of these symptoms, we try to get that patient outside the house now and meet the EMTs and paramedics when they arrive. This way we don't get in a confined space with them. This is something that we've never seen before. We do have a pandemic plan. We follow the county's plan and the state's plan for pandemic planning. One of the essential components of starting the process here is how the 911 system call taker asks and inquires on the questions of the callers. One of the things they're doing, they're following the CDC guidelines, answer the person if they've traveled out of the country, how long have their signs and symptoms been going on, how long they've felt this way, if they've come into contact with somebody that's tested positive, do they just think they have it because they keep on watching the news and convincing themselves they have it? So there's a couple different things there. We're really trying to direct people that think they got COVID-19, that do not need the hospital. We're directing them towards the local emergency numbers for COVID-19. The one that's run out of Upstate Medical Center, calling the county health department, because we got to see if they would even qualify to get the test right now, because we're still short on test kits, and each day there's more test kits getting into the market, but they're still not able to do a test for every person that's complaining of these symptoms yet. If that person is tested positive and they don't need hospitalization, we're keeping them at their home. If you get worse over time, then we can transport you to the hospital.
Report-only calls, where a report can be taken over the phone rather than in person. We're now having the Utica County Dispatch get a number and the name of the person. Will take the report over the phone. If there's a situation we do have to respond to a house regarding a report, we're going to ask that the person meet the officer outside rather than the officer going in the house. But I do want to make this clear to the public. We still will be responding to emergency calls and calls involving a crime in progress. We also are closing off access to our lobby of our police station, where most of the reports are being taken anyway. Again, we have to protect our officers, their families, and the citizens that we serve from spreading the virus. And we have to preserve our workforce, because all it takes is one exposure, and I can have multiple officers now being quarantined for long periods of time. Law still will be enforced. Best thing for everybody to do right now is prevention. We don't know what's going to happen in the future, especially the longer this goes on. The one thing I see right now that bothers me is the panic buying up toilet paper, disinfectant wipes, paper towels. I just believe if everybody just stayed on their normal schedule of buying things, that there'd be plenty to go around. But selfishly, we're seeing this panic buying, and it's creating a huge problem for everybody.
Well, as far as the comptroller's office, we have closed to the public. There'll be no more public interaction for the time being. We will still get the tax bills out on time, obviously our vendor pay, and we'll be here to answer phone calls. We have moved the finance interest date back to May 31st. We may move it back further. So when you get your tax bill, people who like to come in here and pay, don't worry. As soon as this settles, you can come back in and pay. There'll be no penalties. My staff will be working a staggered shift just to try to keep us as safe as possible. Obviously, there's things we have to do, payroll, vendor pay. Of course, people can make their tax payments online if they'd like. With an e-check, it's $1. You can pay with a credit card, but it is 2.5% additional. We have to pass that on to the consumer. Or you can send us a check in the mail. Put a check in the mail, send it to us. We're still going to have people here applying those. And then you can go online and see where you're at. Use the website, the Utica website. Go online, look at your taxes, pay them if you'd like. But if you really like to come in here, and we know a lot of people do, we get thousands of people who do, just wait till this settles, and you can come in then, and there'll be no penalties or interest. The most important thing is that everybody stays safe. Stay home, keep your social distance, and we'll get through this thing together. Just be safe out there, folks.
Bottled water is flying off the shelves in the store. Not sure why. If you are connected to a public water supply, whether it's the Mohawk Valley Water Authority or the City of Rome or any well-run municipal supply, there's no need to worry about the quality of the water. In fact, you're better off drinking your tap water than going to the store and buying the bottled water and putting yourself at whatever risk of exposure you might encounter along the way. The tap water is very safe. It is scientifically demonstrated very clearly that the coronavirus responds to chlorine and other disinfection methods the same as any other bacteria or virus. So the chlorine that we add to our water, the filtration process and purification process, prevents any spreading of the bacteria in the water. It can't survive in our tap water. So our tap water is perfectly safe. There's no need to be getting bottled water and thinking that you're helping yourself out. Right now we're not doing water shutoffs. We're abiding by a national protocol of maintaining services for folks. And so if people have a temporary break in their income, that's okay. There's a grace period. You know, the main thing people need to realize is that the Water Authority is still functioning. We're still here doing our jobs even though the public can't come in and see us. We're still fully staffed to take phone calls. We're taking payments over the phone, by website, by mail, which is where we get most of our payments coming in. The water is extremely safe, and you're much better off with your tap water than you are for bottled water if you're worried about the virus.
We are going to continue, as I said, making sure that you have the best services possible. Let's be mindful of all the people that are out there. Let's be mindful of the people that are working for you at this time. Let's remain to be calm. As I'm speaking to you today, it may be changing from this minute to when this is aired. It's an unknown, we don't know. But please, make sure at this point, we all kind of work together. We're all in this together as one. We are a great city. We are a great state. We are a great country. May God bless you. May God bless our great city, and be well.